All right, well, good afternoon, everyone. My name is Fred Steinman. I'm an assistant research professor at the University of Nevada, Reno in the College of Business. And of course, I currently serve as the Northern Section Director for the Nevada chapter of the American Planning Association. And as many of you have been attending many of our weekly, bi-weekly Nevada APA Northern Section online educational luncheons, you'll already kind of know the drill. Over the last couple months, the northern section of the Nevada APA have been providing these online educational luncheons as a way for the chapter to remain active and continue to serve our membership, as well as our communities, especially in this age of COVID-19 and social distancing. Before we kind of get into the general announcements and Chairman Melendez's presentation, just as a reminder, if you just logged on, please make sure that you mute your audio. That way we don't get any weird feedback and we don't have people talking on top of each other. As a further reminder, this Nevada APA online educational luncheon is being recorded. And in a week or so, we will make this presentation available on the Nevada APA chapter's YouTube channel. Again, over the last couple months, we've been doing weekly, bi-weekly luncheons, really focusing on the impacts of COVID-19 on individual communities, individual jurisdictions, on the planning profession and parts of the planning profession, but also on our statewide community as well. And we are continuing that conversation with today's presentation from Arlan Melendez, who is the current chairman of the Reno-Sparks Indian Colony. It's an opportunity for us to get a bigger sense of our state's community and some of the impacts of COVID-19. Before I kick it off to the chairman, just a couple quick reminders. As kind of a summation or cherry on top of all these weekly, bi-weekly luncheons we've been doing, I, along with a couple other members of the Northern Section, will be hosting a special roundtable discussion on Wednesday, August 19th from 11:30 a.m. to 1 p.m., where we're going to be bringing back all the previous speakers from all these previous luncheons, as well as a few other individuals to kind of share their general thoughts and big takeaways from this ongoing discussion. Of course, I will get you all the information, the Zoom contact information, the RSVP information, as soon as that's available in flyer form, and hopefully you'll be able to attend that August 19th special roundtable discussion. Also for you, if you're a member of the Nevada chapter of the American Planning Association, you should have received from Marco Vallada, our chapter's professional development officer, the save the date flyer for the upcoming chapter's annual conference. This year, our annual conference will of course be an online virtual conference. Again, as a result of all the social distancing and travel restrictions and restrictions on meetings due to COVID-19. But the conference in its virtual format will be held on October 6th and October 7th, and registration for the entire conference is $75. And additional information will be coming out to you in the coming weeks about registration as well. So all that information about the state annual conference, as well as our kind of summation special roundtable discussion, will be sent out to you in the coming weeks. And again, this presentation, as soon as it's ready, will be posted on the Nevada APA's YouTube channel, and all the previous online educational luncheons, as well as some other material, is also available on the chapter's YouTube channel. All right, I've talked enough. It's my pleasure to now introduce again, chairman of the Reno-Sparks Indian Colony, Mr. Arlan Melendez. Arlan, the floor is yours.
Good afternoon. Thank you, Fred. And also I want to thank the American Planning Association for inviting me to speak today. I also apologize for not having a PowerPoint. We really are limited on our staff. Usually when I have full staff, we have PowerPoint and all kinds of things, but there's two of us here today in the office, so it's challenging to try to do a PowerPoint. But anyway, I wanted to just talk a little bit today about some of the challenges that tribal nations, especially in the state of Nevada, are facing in addressing the COVID crisis. Just a little bit about the Reno-Sparks Indian Colony. As some of you may know, we're located here in the city of Reno. First of all, there's actually 27 tribes in the state of Nevada, from Las Vegas to all the way up to McDermott in the north, to the Elko, Tamoak tribes in the east, Washoe tribe to the west, a Pyramid Lake tribe. And so we come together with the Intertribal Council of Nevada every so often to talk about issues, including the COVID coordination as far as funding and all those different issues, trying to get PPE and all these issues that are on a daily basis. But as far as our tribe, we were a small tribe. We have actually 1,180 tribal members, which is relatively small compared to the Navajo Nation, which has 250,000 members. So most Nevada tribes are pretty well, populations are really small, and that's one of our concerns. Las Vegas Paiute tribe has 55 tribal members, so you can see how they could basically get wiped out by COVID, you know, as far as their tribe. And so we take it really seriously about, you know, the challenge that we have with the COVID. We also, Reno-Sparks Indian Colony has been existence since 1917. We actually have 28 acres downtown, just a little east of Kitski Lane, and between Mill Street and 2nd Street was the original reservation, which was pretty much agricultural area. But as you can see, we're surrounded by the Grand Sierra and just all of the freeway and everything else that's happening today. And so in 1986, because of overcrowding, we had about 318 tribal members on this 28 acres, really overcrowding. And so we lobbied Congress in 1986 and were successful in acquiring 1,960 acres out in Hungry Valley. 1,960 acres is basically a 1 mile strip of land by 3 miles long out in Hungry Valley, which is actually, the valley is about 28,000 acres. So we were a strip of land on the hillside in the Hungry Valley. In 2016, we were successful under the Nevada Nation's Tribal Land Act through Congress because a bipartisan bill with Congressman Amadei and Senator Reed, and both bipartisan, able to secure 13,434 acres out in Hungry Valley. So now we're pretty much out in the valley completely, out in Hungry Valley. So in 1987, we built about 160 houses out there. So half of our tribal members live in town and half live out in the rural 18 miles north in Hungry Valley. So we have challenges of trying to provide police, law enforcement in both areas and all the different services. So that's a challenge to us. There's a road, that Eagle Canyon Drive, that leads up 6 miles off the Pyramid Lake Highway into Hungry Valley. And that was built by the Bureau of Indian Affairs back in 1987, I believe. But so that's a little bit about our tribe. We actually became a tribal government, even though we had the land base in 2017. And in 1934, under the Indian Reorganization Act, which was a federal act, tribes were able to establish a constitution and have tribal councils. So most tribes in Nevada started tribal governments in 1934. And so we've had probably about 13 tribal chairmen since 1934. I think I'm the 13th. And I've been chairman since 1991. Well, actually, since 1992. I was on a tribal council 4 years prior to that, in 1987. So I've been in tribal government about 32 years. This year, I'm on my 33rd year. So I've still got 3 more years on a term left. So we'll see how that goes and how I feel at the end of that. So, but you know, this time has been the most challenging with this this COVID crisis. And why it's so serious to tribal people is that in the history of the United States, you know, when I looked back and read some of the history, most tribal populations were wiped out not by wars or anything like that. They were wiped out by diseases. And I looked at some of the, it said, I think there were, even in Mexico, the native tribes down there, it said something like there were 25 million natives in Mexico, and there ended up being 3 million after Hernando Cortez came to Mexico. So it's the same thing in the north. They had epidemics back in 1872 with a Mandan Hidatsa tribes up in North Dakota, and you can see it across history about some of the diseases, smallpox and all those different diseases that wiped out tribes all the way across the nation. And so when you really think about it, tribes know that history. That's why I think that we take it so seriously. And that's why people have asked us, when are we going to open up? Well, when the governor of the state of Nevada, Governor Sisolak, announced the state of emergency, we followed a few days after that in March with a state of emergency. And then because of the cases started we had our first case, I think it was in April. And then we started to take action right away. We had a curfew that we put in place. We had a stay-at-home order, kind of following what the state was doing. We also ended up with some road checks or roadblock areas. So we sealed off Hungry Valley, similar to what the Pyramid Lake tribe had done. Got some pushback from that a little bit on people that were used to traveling those roads, but we did it because we were concerned about, our population and the COVID spread out in both downtown and out in Hungry Valley. So we put all these laws in place that we had to pass by resolution. Our tribal council, we ended up with a team approach. We have a incident command center at the health center. We also have, meetings every morning at 8:30. We have one at noon with the health center, keeping tabs on how many cases, whether they're going up, trying to get a feel as to, trying to contact, trace people, and all those different challenges that we had in trying to make sure that we can stop the spread of this disease. Reno-Sparks Indian Colony, unfortunately, like the Pyramid Lake tribe, which is 30 miles from us, both are near the city. And if you look at the statistics, those two tribes are leading in the amount of COVID cases. I think we have 30 right now, but some of those have recovered. I think there's only 14 that are active cases. The Pyramid Lake tribe, I believe, has about 40 cases. They're a little bit, but their population is about 2,500. So they're 1,000 members. Their population is greater than ours, but we're so in proximity. And when we talk about the challenges that we face, we kind of look at Navajo Nation, as you read, in the headlines, they have experienced, I think, over 400 deaths. And, you would think that because they're so isolated and spread out across the Navajo Nation, you would think that the distance between houses would some way help in the spread, but it kind of didn't show that in some of the information we received, and it's because of one thing that I think that's happening at both Pyramid Lake and both at Reno-Sparks and other tribes, and that has to do with the extended family. And what I mean by that, because we have multi-generational houses where our families are living in houses, and because it's part of our culture to visit one another, and that's the biggest challenge we have. For example, the general population, you probably don't have a relative right across the street or down the same road. Where I live at the downtown colony, I have about 10 relatives all the way down on each side of the street, right? So it's really difficult to keep all of our relatives from one another, just like the Navajo Nation. So on the outside, it's not like that. You may have a cousin in another state or another town, but on reservations, they're so tied to relationships, whether or not that's by blood or whatever it may be, by marriage. So it's really difficult to try to keep people separated when you have that situation. I think that was a situation at the Navajo Nation, is that they had clans that were coming together, to check on one another because they're related. And I think that worked against us. Like I told our tribal people, I said, it works against us in this crisis, but in good times, it's really a benefit because we care for one another and we stay in contact with number. It's like one big family. So, you know, but in this time, it's challenging because it does work against us in trying to keep people. We found out that most, what we have found out, we think that it's being, that's the main reason why it's spreading is because people are not staying home. We're not talking so much about them going into the city so much. I think it's among our own tribal members where we're more concerned. And so that's kind of, so in the back of our minds, we're, you know, people asked us, when do we think that we would open, you know, and I was telling our tribal membership, because I'm on a Facebook every week where I keep them informed, and we broadcast every Friday to our membership and give them the statistics of how many cases do we have, how many people are recovered, and try to caution them to stay home. You know, just like the 4th of July, you know, we had people that have gone to Pyramid Lake. We have relatives at Pyramid Lake. In fact, my mother's from the Pyramid Lake Reservation and my father too. And so you can see we have this connection to Pyramid Lake 30 miles away. So it's pretty hard to separate the tribes from traveling within the 30 miles. And then the Washoe tribe, we also have 3 tribes in one. We're actually Washoe, Paiute, and Shoshone. So we have relatives at the Washoe tribe over towards Gardnerville, and we have relatives at Pyramid Lake to the north here. And so you can see that we're like one big happy family, if you want to say that, but it's kind of challenging to keep everybody separated. So I think that's the most challenging situation we're in now. Now, when this, when we really talked about the assistance that tribes needed, you know, we were really, we have, you know, the federal assistance, and everybody knows about the CARES Act that was passed. It not only benefited tribes, but there was about, I think, $8 billion that was set aside for Native American tribes across the United States. So there's actually 576 tribal nations across the United States. So there was 8 billion that they actually sent out by population, which was kind of a challenging thing. And so we're supposed to try to spend down this money by December 31st, you know, and that's a challenge too, because any of those expenditures have to be tied to COVID. In other words, you can't just spend it on anything. So, and after that, any remnant funding that you have has to be returned back to the Treasury Department. So tribes are in this real challenge. And one of the challenges we have was guidance from Treasury. How do you spend this? Can you just send it to individual people to help them out? And, you know, they didn't give us clear guidance. And so tribes were in this real predicament that if you sent it out and it was unallowable, you'd have to pay it back. And if you didn't spend it, well, then Treasury would recapture that money. So you're kind of in a situation. Do you take the chance and have to pay it back, or do you actually hold off and then you would just send that back to Treasury? So I think that was the biggest challenge on this federal funding. And plus it didn't come out in a timely manner either to get to the tribes, as usually is the case. I think we lost a couple of months in trying to get assistance. And as you know, we were trying to get PPE, protective gear. We actually had to close some of our businesses because of actually lack of PPE. And we had some retail stores that 5 in the city here that actually were drive-throughs, but we had to close those for about 3 weeks just to find PPE, masks, and all those different things, gloves. And so it cost us economically just to shut down for 3 weeks until the tribal council was sure that we had that protective gear. So we lost revenue there as far as some of our retail stores. But we were very fortunate, the Reno-Sparks Indian Colony, because of our location in the city. I think some of the rural tribes, even though, you know, as far as the COVID cases, they seem to be down. There's only 1 or 2 cases on most of the reservations throughout the state. I think there's only a few in Elko and Walker River. So you kind of see that Reno-Sparks and Pyramid Lake tribe closer to the city are the challenges right now for you know, our tribes here in the state of Nevada. And so that's kind of what we're facing right now, trying to come up with uh, ways in which to spend money as far as the COVID money and tie it to some type of project that's related to COVID. You know, whether or not that has to do with isolation from people because of the generational houses. If one person gets it, some people within that house might want to move out of that house to a single dwelling, and we're using some of the resources off reservation, you know, like the county has some housing that you can, if you wanted to isolate there, you can do that. And so, so those are challenging. So tribes are looking at ways, can we have some type of modulars or something, some type of dwelling where we can isolate people that want to get out of a multi-generational household that has more people living in that house, you know. So that's the challenges we're facing right now. But other than that, you know, we're taking it one day at a time, but every day seems like a new problem comes up. So we're constantly with and we had to one of the first things we had to do was we had essential workers staying on the job, and we have 360 employees with the Reno-Sparks Colony. So I'd say only about, I'd say 1/3 of those are actually essential. So the rest of them are at home right now, hoping that we open up at some point, but some of them want to come back. Maybe some of them don't because they're still cautious about contracting COVID. So we've got this real challenge. And now we're working on recovery. How do we phase in recovery? You know, we're working on refitting some of our buildings as far as plexiglass, a separation of workers that come back. So we're working on that right now. Every month we have a meeting where we decide whether or not we're going to extend the curfew, whether or not we're going to extend the stay-at-home order, whether or not we're going to extend the roadblocks, you know. And the roadblocks, I think those were the most challenging. I know Pyramid Lake got a lot of negative feedback from community people that didn't understand why they were closing off the lake. And we did too out at Hungry Valley as we closed off at Eagle Canyon Drive and those things. We had off-road vehicles out in Hungry Valley that the tribal council wanted to curtail. Not only that, because it was fire season also, they didn't want the potential to having a fire in the midst of COVID crisis, you know, so that was another challenge. Like at Navajo, I just saw they have some fires down there in addition to this major crisis on COVID, and it could be the same thing here with fire season. So I think it was a good thing to close the reservation and just allow residents in for right now. But we hope that the surrounding community would kind of understand the reasons why we kind of took those actions, because of our small population and the history of diseases and all those different things that makes us extra cautious about you know, making sure we're safe from this disease. And then you know, right now, as far as recovery, we're looking at all kinds of different things. You know, we're reassessing our buildings as far as how the airflow circulates through the ventilation systems and all those different things. You know, additionally, we had to put people on, we were fortunate, we had some incentives like paying hazardous pay to people that were on the front lines, you know, as opposed to, people didn't think it was fair for the people that weren't essential. They're at home, and we were able to keep them on the payroll. So some of the people on the front lines felt, well, why should I have to work? And people at home would basically make the same as me. So the hazardous pay was kind of an incentive for the people that were on the front lines, that were you know, in contact with people and all those different things. So I think it was good to be able to offer hazardous pay to people that were on the front lines. The other thing we did was, in following with what you know, there's been this controversy, well, it's been an issue of whether or not you should test as many people as possible. In fact, tomorrow, we're going to be testing 500 people. I just mandated yesterday that all of our employees who are essential are going to go and get tested at the health center downtown here. So the idea is we would rather know, you know, within the people that are actually at work, whether or not anybody has COVID. So we did this about a month ago out in Hungry Valley. We had the National Guard come in, and they worked, and they had, I think, about 300 tests that they did. We weren't sure whether or not our community would participate, but we actually had 274 out of the 300 that actually in Hungry Valley tested. And out of those, only one person was positive out of all the people out in Hungry Valley who tested out there. So we were really pleased with that. We weren't pleased that the one person was positive, but it could have been really devastating because we already had, I think, something like 10 cases we were contact tracing back. So if we would have got an influx of, say, 10 more people that turned up positive in this mass test by the National Guard, that would mean our tracking people would have, they would have been really kind of trying to overwhelmed, I guess you would say, but we were fortunate that number was low. Now we're going to do this other one for the downtown colony, which we have about 500 people here. And we're also doing it, we're doing 2 days, we're doing one tomorrow. So all the employees are going there, including myself, even though I tested a month ago out in Hungry Valley. I thought, well, we just will test again. So we'll be over there tomorrow morning and we're going to test again and then see what that outcome is here. And so that's not just for our employees, but it's for our community members. And then Friday, the urban Native American population. We have a urban population here in the city of Reno in Washoe County that's about, I forgot what it is, something like 8,000 people or something like that that use our health center. So our health center through the Indian Health Service, we don't just service the 1,180 tribal people. Within my tribe, we service all of the Native Americans in our catchment area, which is Washoe County. And so we have to provide, testing for them also. So they're going to be on Friday, along with anybody else that, any employees that miss Thursday. And I don't think they'll turn anybody away, so that's going to be at our health center this Friday. So hopefully we'll look at those, see what happens there. And I hope it's a low positive count this time also, just like in Hungry Valley. That'll make us feel a lot better that we have, that things are looking a little more positive, than having that count go up because of more testing. But I think more testing is good because we really have to know what the truth is here about who's come down with it or who's, I think it's a good thing to know. So I just wanted to kind of say that those are things we're working on right now. As far as people coming back to work, I think we're going to phase that in as I follow Governor Sisolak. I know if you move too early, you can, end up, have to go back to square one if it doesn't work out. So we're real cautious about bringing people. We'll probably phase people in, people that are isolated, like a grants writer that works out of office by herself. We'll probably bring her back first rather than, where people are in one office building, those type things. We have a finance department here that's alternating. They have shifts, so they're not all in the same room at the same time, and they wear PPE, and they have to be safe distancing, and they have the plexiglass in all of their offices and all those different things because we have to still use payroll and we still have to pay bills. But so I think the other thing is we're trying to keep business going as usual. We still have employees out there on the payroll. And so we also have obligations that we have to pay a certain amount of loan payments and different things like this. So we need those people on board. We are still hiring people every so often, for whether they're temporary or wherever we need assistance. The challenge we had, I think, at our health center was that, these pre-existing conditions, it's almost as if, you kind of say, well, there's a lot of people working at our health center, but, if they have pre-existing conditions, well, the tribal council wants them to go home, and not be able to, catch COVID or something like this. So that was a number of employees out of our health center that are not at work today. So they're kind of stressed at the health center because they don't have the full workforce that they usually do because of people's age, and different things that put them susceptible to COVID. So I think we have all these challenges. that we're working on. We try to share with the other tribes too. The Nevada Indian Commission, which is a liaison between Governor Sisolak and the tribe, actually keeps us informed as to what, and the governor's very interested in what the tribes need, whether or not it's PPE or anything like that. So we're in contact all the time with the governor and the state legislature and some of the people we work with. And it's really hard because we have, for example, we have a freeway right next to us, and they're moving forward with expansion, which is real near the colony. And so we have to be in dialogue with those people, even by Zoom. So somebody has to be here because you have to kind of make sure that the plans that we agreed to are going to be followed with this freeway here at 2nd Street and near the Walmart store here. And we were fortunate that the Walmart, did pretty good. It was a business that was located on tribal land. So we have a tax sharing agreement with the state of Nevada so as long as Walmart was open, the tribe still had some income, and so did the state as far as the tax revenue that was still coming in. And so there were some essential, and what that did to us too, because we leased to quite a number of business on reservation land. And so what it told me was that in the future, when we start to bring business to the reservation, whether or not it's not a business operated by the tribe itself, but if it's somebody else that wants to lease on tribal land, it makes you think about, well, if COVID hit, would that business have to close down? And I'm glad, there were some economic projects that we were considering, and we kind of held off on it because those would have been owned by the tribe, and we would have managed them, and we would have took out a loan on them. And if this COVID if we would have went forward with that, I was thinking, I'm glad we didn't now, because we would have had to lay off all those employees. We would have had to, we would have been in challenging times if we would have went forward with some of these economic development projects, which the tribe would actually run themselves. So I think it opened our eyes to being really selective in economic development ventures because we never even considered COVID or how that could affect business. But from now on, we will kind of put that scenario into the equation as we think about, leasing on tribal lands to businesses that come onto tribal lands or running one ourselves. So I think it really kind of helped us think outside the box as to our economic development planning into the future, because it kind of worked out for us this time because we were able to keep some of those businesses open on reservation land. Even though we're sovereign, we've always tried to stay, if the governor says close something, I think our tribe has always felt that, well, we're not going to, because we can tell the governor we're sovereign and just do the opposite as a state and say, look, you don't tell us what to do. But I think in our relationships with the state and with the county and with the cities, we've always kind of considered that relationship. So if it was for the best interest of everyone, then the tribe pretty much will follow in what the state is doing or what the counties or the cities are doing. So I think it makes good business in those relationships that we are trying to contribute to protecting the citizens of the state also and doing our part. So I think it really was a good thing to have those relationships. And when I first came on as tribal chairman, I think one of the foundations of success was that in building relationships, and even though we're sovereign, we built relationships with the county, we built relationships with the city, with the planning agencies. It wasn't just chairman to the mayors, it was actually our planning department to their planning department, our emergency services to the county's emergency service, even with some of the emergency services. We went up up there by Park Boulevard, did a press release with some of the county officials. I went up there, and because we were all on the same page, and the tribe didn't want to be left out of not only resources but things that we didn't know about if we weren't part of that connection, and so it really helped us, because I think that's where some of the information on using the National Guard and all those different informational things. So we know that it's good business to make friends and to really tie into those resources and become part of the Truckee Meadows and really have good relationships, because whether it's a flood or whether or not it's COVID, you know, we help them with fire, you know, our fire trucks on different type of fires out in the brush, you know, we respond to. Our police departments have agreements, you know, with the local counties. We're on the scene too many times. And so I think we have this good working relationship in agreements and all those different things with everybody within the city and the county. So I think it's a good thing, and it really paid off during these COVID crisis that we're in. So I think and from a nutshell, that's kind of what we're kind of addressing right now. And but anyway, Fred, in a nutshell, that's kind of where we're at right now, but just taking it one day at a time, and hopefully that will open soon. But you know, we want to be cautious about doing that, and we'll probably be the last one to open. I tell my membership, so. But they're okay with it though, so I think that's good.
Absolutely. Before we jump into Q&A, just again, you know, on behalf of myself and the entire Nevada chapter of the American Planning Association, thank you, Chairman, for taking the time to present today. We certainly understand that you're very busy, especially these days. We do appreciate you taking the time to meet with us. We do have about 20 or so minutes left. Does anyone have a question? You can either say your question out loud, or you can text the question using the Zoom group chat function. And in fact, Scott Carey has beaten everybody to the punch, as he usually does with a question. Scott thanks Arlan for the excellent presentation. The question: how has COVID-19 impacted the way that the colony provides services at the senior center and health center, and how has the pandemic impacted overall service delivery to individual elders in the community?
You know, that's one of the challenges. We did have actually a person within our senior center who, you know, where we did get a positive person. And so we had to close down our senior center. In fact, it's closed right now. So what we had to do was we had to go to our friends again. And so the county stepped up, because we deliver food to our seniors on the reservation. So they have Meals on Wheels, one of the programs where they actually, we just, even though we'll pay for it out of our seniors' budget, but it kind of helped us to still provide the meals to our seniors who we deliver to here on the reservation. One thing, we are fortunate because we're not like some reservations where they're like ranches or farms where you have to go way out. You know, Pyramid Lake, they have some housing that are clustered, but they have farms and ranches and all those different things. We're very fortunate that our housing is clustered in different communities here, and you could walk downtown Reno-Sparks and deliver flyers in about, I'd say about 40 minutes or something like that, one side up the other. So in delivering lunches and those things, it's pretty easy here compared to some reservations at Reno-Sparks. So they helped us with that. We had to do some testing, because once one person is a positive, then you got to have your whole senior staff or any other program we have tested also, and they have to stay out for 14 days and to see what happens there. So we have this kind of a policy that's happening with all of our programs. So you know, it's unfortunate though, we just don't know who might come down to it, and we can't control people's off-hour activities. You know, that's the challenge just in the workplace. So you never know who's going to come down because of, you know, whatever activities they have on the weekends or whatever, but that could be any of our programs. So, but I think we are pretty good as far as, we actually renovated our senior center downtown. So we were out in Hungry Valley operating out there temporarily till we got the renovation. So we finished the downtown renovation. So our senior center, because what happens if somebody gets COVID, they want to clean the whole building, right? And so by moving them down to the downtown facility, which is ready to go, then they can basically they're okay as far as that building being clean and not have to do so much disinfecting and everything you have to do because, you know, surfaces and all that stuff. So I think it's working out okay right now. But and that brings a good question, because even if our health center would to be contaminated, you know, they want, sometimes tribes will want a deep cleaning, and they'll close down for a couple of days, and they'll contract with somebody to come in to do a deep cleaning and disinfecting. And if you have a large health center like ours, 60,000 square foot, well, that's a lot of deep cleaning to do, as opposed if you had a small health center like, you know. And so we're kind of looking in our future planning. I was thinking, well, there's been an idea to build a satellite health center out at Hungry Valley, you know, so that might come more to the forefront in our future planning, because then if one facility was kind of contaminated or whatever, you could move your operations and still see patients at Hungry Valley. So this idea of having multiple sites really comes to the forefront, and I think we're going to be considering that in our future planning here.
Excellent. Any other questions from the group? Going once, going twice? Well, all right. I again want to, you know, sincerely thank the chairman. Thank you, Chairman, for taking the time to present to our group on both my behalf and representing the chapter. We really do appreciate the time that you've taken out of your day to present to our group. And of course, thank you to everyone who's been able to attend this meeting as well. Again, just a couple quick reminders. This presentation, the chairman's presentation, will be posted on the chapter's YouTube channel within the next week or so. Our next online educational luncheon will likely be the special roundtable discussion scheduled tentatively for August 19th. And more information will be following. And the Nevada chapter of the American Planning Association's annual conference, again, scheduled for October 6 and 7, virtual conference, the entire conference, registration $75. And more information on that coming as well. Again, thanks to everyone for taking the time. It's been a pleasure joining you from the main campus of Great Basin College in Elko, Nevada today, and look forward to the next opportunity for us to get together. As usual, stay safe, stay healthy, and please enjoy the rest of your week. Thank you.
Thank you.